Happy New Year, everyone. This is a follow-up video to the vaccine safety video that I released previously. One of the companies that's making the vaccine, Pfizer, released a briefing document to the FDA that gives an executive summary that includes some of the safety information. So just reading directly from the executive summary report, safety data from approximately 38,000 participants greater than 16 years of age, randomized one-to-one to vaccine versus placebo with a median of 2 months follow-up. So this is how long after the injections they followed these patients. In summary, did not raise safety concerns. But there's a couple interesting things here that they mentioned subsequently. The most common solicited adverse reactions, these are self-reported reactions, were, as I mentioned before, fatigue, headache, pain at the injection site, muscle pain, chills, joint pain, fever. But the next line I find to be a little bit curious. They say the frequency of serious adverse events was low, less than 5%, without meaningful imbalances between study arms. Among non-serious unsolicited adverse events, there was a numerical imbalance of 4 cases of Bell's palsy in the vaccine group compared with no cases in the placebo group, though the 4 cases in the vaccine group do not represent a frequency above the expected in the general population. So this is kind of curious wording, and I think they're trying to downplay the significance of this, and from a statistical point of view, they're probably correct in the way they've worded that. But this is what people are talking about in the press right now, or over the last week. When this came out, a lot of people jumped on this and said, "Oh, this is causing paralysis of facial muscles." So my take on this is that, yeah, it is a little bit curious or interesting that 4 cases of Bell's palsy in the vaccine-treated group and 0 in the placebo-treated group. This may cause some people to make some conclusions that of cause and effect, which is probably inappropriate at this point. And I'm sure there's going to be people looking at this more closely now. I would remind everybody, number of participants, 38,000 participants, and of that, 4 cases of Bell's palsy. So I don't know what that is, approximately 1 in 10,000. Otherwise, there were no notable patterns of numerical imbalances between treatment groups for specific categories of non-serious adverse events, including other neurologic, neuroinflammatory, and thrombotic events that would suggest a causal relationship between the vaccine and the symptoms. So they didn't find any other statistically significant serious adverse effects, and they at this point are dismissing the causal link between the vaccine and Bell's palsy. The data that Pfizer reported is actually displayed in a couple tables on this CDC website as well. The last paragraph on this page, there's a little bit more information about serious adverse events. So again, these are reported by Pfizer and from 38,000 participants in the study. On the CDC website, it says the most common serious adverse event in the vaccine group, which were numerically higher than in the placebo group, were appendicitis, 7 in the vaccine treated group, 2 in the placebo treated group. So again, that's a pretty small number out of 38,000, but there were more in the vaccine treated group than the placebo group. Acute myocardial infarction, three people that received the vaccine had a heart attack, 0 in the placebo treated group. Again, pretty small numbers, but they're obliged to report this information. And overall, the proportions of participants who reported at least one serious adverse event were 0.6% in the vaccine group and 0.5% in the placebo group. So despite the fact that there were a couple reported serious adverse events which were more prevalent in the vaccine treated group, overall, when you lump all of the serious adverse events together, there was no difference in the vaccine group versus the placebo-treated group. So that's full disclosure on my part. I, again, wanted to make sure everybody had the right information and that I wasn't misleading anybody uh, in the first couple videos that I put out there. I'm still generally in favor of people getting vaccinated, particularly if you're over 50 or 60 years of age. I think the risk gets higher, obviously, as you get older. So there's a stronger argument that you should accept a small risk of an adverse event from the vaccine in favor of protecting yourself and your family and your loved ones. That said, if you do have history of autoimmune disease, um, reactions to vaccines, certainly talk to your doctor about this kind of thing. If you have a history of Bell's palsy, perhaps talk to your doctor about that. There are small risks, like I said in the previous video with other vaccines. There have been reported adverse events. This vaccine, it seems like the frequency that those things occur is in a pretty similar range. One of the things I didn't mention in my comments about the previous video that was that fellow speaking in Harrisburg was that he was apparently speaking on behalf of some law firms and groups of people that wanted to change government laws or policies about what could constitute a legitimate lawsuit against the drug companies or against Department of Health and Human Services, because currently the government has taken away liability on the part of the drug companies because this is an emergency situation. We want the drugs out there quickly. They've basically said to the drug companies that you have limited liability or no liability if people get sick from the vaccine, because we want this vaccine out there quickly and as soon as possible. So all of the long-term safety testing is not happening before the people are actually getting vaccinated. So the typical course of drug development, the safety testing would go on for quite a long time, years perhaps. This is not happening obviously now. So the drug companies have a legitimate argument, like we can't collect the long-term data before putting the vaccine out there for public health reasons. So we don't want to be sued for millions of dollars if we can't collect this data and have a full understanding of the long-term safety effects. So I can see the argument on both sides, and I understand where the patients are coming from as well as where the drug companies are coming from. So it's just some other subtlety that you might want to think about in terms of, is something nefarious going on here? Are the drug companies trying to just make a lot of money but put us at risk for some reason? Or is this just a situation where we have to accept a certain level of risk for the sake of public health?